Thank you, and thank you for bearing with us during your probably well-deserved lunch break. And I'm going to start by sharing a little bit the investor perspective on this sector and on the particular company, Natural Cycles. My name is Leybold. I'm one of the partners at e.ventures. We are a very international venture capital firm, being present in the United States, and Europe, Asia, Brazil, and Eastern Europe. And we recently invested in Natural Cycles. We are very hot on the mobile sector, probably pretty much like any VC or investor you all meet these days. And of course, you know that people spend more time today on apps than they actually spend on desktop and things like that. But I think what's interesting for us, we're very simple-minded. We have to make money. And the bigger the companies can get, the better for us. We invest at the early stage when they're still very small. So how big can that ride be? And the fantastic thing about mobile is that you immediately have a global audience, and you can immediately charge them and make money from them through all the app stores. So we think that's an opportunity that is tremendous in terms of building very large businesses out of Europe. Spotify is the one that always gets mentioned, but I think e-health is a particularly interesting sector where mobile as a platform can be a tremendous value driver. So when we look at that market and we looked at Natural Cycles, we were impressed by the fact that you can now develop or deliver a really customized solution to women who interact daily with their phone to replace something that has been a big pharma, slow-evolving product over the last couple of decades, which is the pill, and give them a much better experience. So we think it's a market where you can, for the first time, really talk to your customer the way Big Pharma has never been able to do. You can create a much better product, and you can reach customers and consumers much more quickly and engage with them in a much better way than anything coming out of a cardboard box would ever be able to. So that's why we think you can build amazing businesses around the whole health sector, and that's why we invested in the company and why we as investors are very excited about what to do there. So with that, I'm going to pass over to the guy who's doing the real work, which is always the entrepreneur and the founder, Raoul, who's going to tell us more about the product itself.
Yeah. Thank you, Christian, for the introduction and for investing. So my name is Raoul Scherwitzl. I'm the CEO of Natural Cycles. And voila, my slides are here. So Natural Cycles is a fertility app that informs women with very, very high precision when they can get pregnant and when they cannot get pregnant. So they can use this information to prevent pregnancies. So all the woman needs to do is to measure her temperature in the morning, and the app tells her the rest. It's clinically tested, and I think it's a very concrete and unique example where one app can replace a pharmaceutical drug that is currently used by hundreds, millions of women worldwide that pay for it on a recurring basis as well. So, and this defines also our vision. I mean, we want to become a default choice of birth control worldwide, and it's a very scalable solution. You just need an app and a simple thermometer. And when we'll achieve that, I think the most important thing that we'll achieve is that it will become a routine item of personal health information for every woman and her partner to know when you can get pregnant and not. And then you can make an informed decision on probably one of the hardest decisions and most important decisions in your life, about life. So this is very exciting. The way it works is in the morning, when the temperature is still low, you measure your temperature in the mouth, and then you enter it into the app, and then you look at the fertility status that our algorithm returns. And it's very important to measure the temperature because the temperature indicates when ovulation happens. And if you don't measure temperature, then you're a little bit blind in the middle of the cycle and you cannot tell. So this is an important point to take away. And so as I said, you can use this information to prevent pregnancies. So the app will look like this soon. You get basically a red or a green day. On a red day, there's a risk of pregnancy. So you're supposed to use contraception, like a condom. And on a green day, there's no risk of getting pregnant. So you're considered not fertile. So there's no risk of getting pregnant. And And this information, of course, it goes a little bit beyond just preventing pregnancies. You can, of course, use it also to plan pregnancies and then monitor pregnancies. And then you go back to prevent pregnancies, and then you plan your second one, and so on. So you have one solution for the entire reproductive lifetime. And what I like about this is that the time that you spend on contraception is then no longer lost, because all the data that you accumulate makes the statistics more accurate, and then you can use it to plan your pregnancy very accurately. This is, for instance, how my wife and I, we're both the co-founders of this company. This is how we planned our child. We tweeted 2 months before that we will try for the first time in 2 months ahead, and it worked right away. So we were very lucky, and we're very happy also about this. So yes, so you can use it to plan a pregnancy, and then instead of green and red, you get a scale of red days to highlight the red days. And Natural Cycles is also is going to be the first one to know when you get pregnant. So that we will ask you to take a pregnancy test and confirm the pregnancy. And another use case, for instance, is also you can use Natural Cycles alongside another birth control, for instance, like the spiral, which is very safe. And we had some users that use it alongside like this, and when sometimes even the spiral fails, and then Natural Cycles told them that they are pregnant, and that's valuable information, because then they can go to the doctor and take it out. And finally, when they do get pregnant, then the app turns into a pregnancy monitor, and then there are lots of apps out there that monitor pregnancy. You see the baby developments, you get some tips of what to do. One very interesting feature is that we also have a miscarriage detector in the first trimester. So if a miscarriage is due to a drop of a certain hormone called progesterone, we will detect this in the temperature, and then they get a message where they should go see a doctor. And like this, we could save a few babies already with this feature. So we're really proud of that one too. Since we are former researchers, this is really our thing, research. We're really good at this part. And we have performed 2 clinical studies so far that show basically that our result, that our product really works. And we continue to invest in this area, because I think this is really something very important to continue doing. And so all these features that I've been mentioning, all these great features, they're not something that we plan to do. It's something that exists right now. You can download the app and start using it tomorrow. And it's used by lots of women all over the place, but mainly in Sweden at the moment. And they entered so far million days of data have been spent on this app. They open it almost every day. So it's and we see from the feedback that we really have a huge impact on their life, and this is really a wonderful feeling. And with this, I'd like to thank you for your attention.
Yeah, we wanted to take a couple of questions. So, Raoul, disruption of the pharma, that has been traditionally a big challenge. How do you see that taking place now in the mobile and digital era?
Well, I actually like to see that we take the best of both worlds. So I have huge respect for the pharmaceuticals and the drugs that they have developed. And I think what we combine is the best of both worlds. So the pharma is really good at performing very good research and providing new solutions to diseases. And the tech world is very good at providing excellent user experience. And we're combining the great user experience with this very deep research that we're doing. So I kind of see us a little bit in between, combining the best of both worlds.
So then if the traditional approach is getting a lot of distribution out, and once you have distribution, you have in a way market power, so perhaps you can turn the pharmas into your customers and then help them deliver their contraceptives and stuff like that. Is that type of on your roadmap and in your strategy perhaps?
I mean, the data that we accumulate is of huge interest for the farmer, but and for us, because we can suddenly look at things at a really large scales, at different cohorts, whether it's geography, age, BMI, activity level, and we can look at fertility, how this is affected by all those things in one place, and I think that is of tremendous value also for pharmaceuticals. So so I think I look forward to working with them on things like that too.
Brilliant.
I mean, I think if I can just add, it's very simple. If you're big pharma, the way to interact with your customer is extremely costly, right? You do it through studies and all of that. Suddenly, you have people that use the product every day. If you somehow use that platform for interaction, you can get to a completely different level of feedback and speed in learning about your products, which I think is an amazing opportunity.
Yeah, I would agree that you know the pill of the future might be an app, because then you can really deliver it to the individual. So guys, thanks a lot for coming to Slush.
Thank you. Thank you.
Thanks a lot.
Thank you.
Take care. Thanks.